Okay.
So what we were talking about before was kind of like Rishi Sunak's and the government's new idea to kind of reduce the waiting list by about 3 months, right? So his idea is you can have an app that's interlinked through the normal NHS app, and you'll be able to have a look at the different hospitals available once you have been referred somewhere. And you'll be able to pick a hospital depending on their waiting list, size, how many weeks it is, and how far you have to travel. What are your guys' kind of initial thoughts on that?
So would the patients be having a look at the waiting times and deciding where they want to go?
Basically what would happen is you would see the patient, you can either do the referral or however it works in particular practices, and then send them out to the admin staff who can show them a list of the kind of different hospitals that we have available. And then depending on where the patient wants to go and what the waiting list is and how happy they are to travel how far, they can choose from 5 different hospitals or more, and then
Anywhere in the country?
Anywhere in the country.
Can the patient choose what hospital they want to be referred to? Like how many hospitals they want to be referred to?
Yeah, so they would choose from a list of 5 or more, depending on what they want.
They can choose more than one?
They can choose more than one, but in the end they do have to, they have to pick 1, 2, 3, 4, 5, basically. Like
to book in the appointment.
Yes.
Don't they just have to select the one that they want to book into?
Yeah, but they can pick from 5, and then basically what happens is they get an email, and on that email they'll have the list of all the waiting times as well, and then they just pick from one in the end.
Definitely there are advantages to it and disadvantages. I mean, the advantages I feel, of course, to reduce the waiting time. I think also it gives the patient the opportunity, or he can decide where he's going and he can plan things ahead, I think. So I think that's really good. In terms of medically, of course, if there is any condition that needs to be detected early or the treatment needs to be started early, that gives that opportunity where they can actually start and plan the management. How do you guys feel about that?
Okay, go first.
You're saying that can they choose 2? More than one. I don't. Do you think they can? Because if they get appointment from both of them,
I was going to say that.
Yeah.
I think they would only be.
So I think they can only choose one.
In my experience, whenever I got a hospital appointment, it always got postponed. So it didn't matter where I am on the waiting list, because I would always end up being dragged to the bottom again.
So some hospitals obviously work in different ways. For the hospitals that we have around here, their waiting lists are a lot longer. So for example, 38 weeks is the average for a neurology appointment, right? Whereas if you refer outside of London, up north especially, it's about 18 weeks. So to be honest, even if your appointment got postponed, you'd still be seen before an appointment in central London kind of thing. So it is...
And do you want to share what you looked at a patient today, didn't you? Do you want to share what that patient with a headache?
Yeah.
I think it was your patient, Faith.
Yeah, so there was a patient this morning with a headache, and we did a neurology referral for them, and we looked at kind of the waiting list and the miles away from where the patient lives, and I believe that there was a hospital in Dorking that was 18 or 20 miles away from here, and it was an 18-week wait, right? And so that's really good. And then when I looked for the local hospitals around our area, it was more 38 to 42 weeks. So there is a big difference between the waiting list for central London kind of areas and outside of London, exactly.
But as we were discussing in terms of, let's just say the patient chooses to go to Dorking, what about in terms of follow-ups, their GP notes, the blood test results, how would that merge? Unless we're using the same system throughout the country, that can be a problem.
That can be a problem.
That is.
I was going to say, what about for patients that need transport?
Yes.
For a lot of people.
They definitely would not get transport. They would have to organise it themselves.
Because transport is dependent on catchment area, right? So we're quite limited on even Ashford Hospital, which is one of our local hospitals. They don't expect transport for us. So it is a bit complicated. That stuff hasn't really been I don't think anywhere has really been looked at as of yet. It's quite still very new, this new thing.
Faith?
It sounds like a good system. I don't know what it's going to look like in practice, especially because there might be barriers for certain people to get to the appointments if we're relying on them to make their own way. And then also, like everyone else had said about the follow-up, getting those results, are the hospitals going to know that they're from out of area and therefore make sure they have all the documents with them when they come back? It would be interesting to see how it actually plays out in practice. But it sounds like a good idea if it means people potentially waiting less to be seen.
And it's called patient choice, so different factors will go into that. The patients can decide. And actually there'll be private providers that you can have as well, which are free of charge to the patient to increase capacity. Ames?
I'm inclined to agree with Faith. I think like one of the main drawbacks is obviously the distance, and some patients are going to struggle like financially to get to different hospitals and stuff like that. And as well, like Dr. Khalid was saying, unless we have like a shared system, it's going to be really complicated to like keep track of these patients. And if we need medication changes or amendments, like looking through results and stuff, it's going to be really hard for us to do that if we're not on the same system. So that's something that really definitely needs to be looked into.
Thank you. Martha?
I feel like it would work for young patients with flexible jobs and a car. If it's someone who's elderly and doesn't really have family or doesn't know how to use a computer, it just wouldn't work.
Okay, thank you.
Yeah, I think I agree with Martha. My concern was the elderly population, because I think with them it's hardest arranging the transport, getting to the appointment, the distance itself. So I think we need to maybe have some kind of a system, I don't know how they're going to incorporate that, where that particular group of patients can be addressed in a different way.
Yeah, for me, I feel like I agree with what everyone's been saying.
Not all agree.
No, I agree, but I feel like, I don't know, like there needs
Because
to
you
be...
always speak your mind, you know, which is
Yeah.
like something controversial.
Okay, I don't agree. No, actually, I don't agree. No, I don't agree. Like, I think it's a good idea. However, yeah, for older people, it won't be great. For the younger population, it might be sustainable, but how long can they keep that for? So it's just trial and error. I'm not sure. Maybe they need to test it out, or as well. I was going to say the communication that they have like with the patients. So how would that all work? Is it going to be a system that they're going to introduce to the patients to then communicate with that? It's all about the communication, to be honest.
I do think overall it's a good idea, but I think there is going to be quite a few kinks that do need to be sorted. I think at the end of the day as well that a lot of patients are going to see it and say, oh, I can book myself in. But then where are all these appointments going to come from? Then it's going to be just the same.
So how about patients that have children as well? So single parents, people with no support, children with disabilities as well. Like the transport to then get to that appointment is going to be quite interesting. So unless there's something that can support people with that, then I don't think that would.
No, I really, not to be negative, but I really doubt like a hospital in Northern England is going to pay to transport someone even like the most like highly disabled or the most vulnerable all the way to them, because they just won't think the cost is suitable, right?
Faith, what were you saying about the freeing up space for people who are?
I was thinking that it would be a good idea that if patients get appointments elsewhere in places where they can actually travel to, or at least some of them do, then that would free up space in hospitals for those that can't travel or aren't maybe as mobile or able to access services that are further afield. So potentially that could be a good thing, because you're balancing out the provision of services.
And can I ask the clinicians in particular, what do you think about people who are undiagnosed with illnesses, who then, a lot of evidence suggests that you need to start treatment early, but these delays are resulting in poor outcomes in the long term. Have you got any thoughts about that?
I think if these appointments are going to be to see specialists, if it's to get access to, then it can only be a good thing. Because the sooner they're seen, the sooner specialist intervention can be started. The sooner people can get medication and start feeling better. There's no that delay to treatment. And hopefully that would mean preventing advanced disease and like all the complications that come from that.
And the worry as well.
And the worry, yeah.
And not just the patient, like the family.
Family as well. You know, interesting thing, what Faith said is to see the specialist. We were talking earlier about we don't really need any investigation, but sometimes if you think about it, if it's my first appointment, I haven't had any investigations done, I'm going there to just get a blood test. I think that's going to be a long distance. So I think maybe initial investigations will should be, I think, relevant and carried out in the primary care setting if possible, just because it's going to help in terms of the patient travel distance. Because imagine if the first appointment is just for the blood test or x-rays or scans, then you have to come back for that, for a follow-up review, and then to initiate the treatment. So that is actually, by offering some initial treatments in the primary care setting, I think we are reducing the time when we can actually start the management.
Doesn't each postcode area have different guidelines on what they can and can't do?
So NWL has different guidelines for fertility referrals than, for example, further up.
It would be nice, I suppose, if it was possible to do everything, if it was like a one-stop shop.
Exactly.
Like if they're going there,
No, for example,
Same overall is good, but there is always problems for when we start a new thing. So we need to test it.
We need to test it out.